Hi there, and welcome to UEA Mental Health Nursing. And today I am joined by Gabriel. We were just chatting about what we should call you.
Yes, it's Gabriel, but Gabe is fancier.
Yeah, wonderful. And I know, Gabriel, I encountered you on my very last placement of my mental health nurse training, and we've bumped into each other in our career paths ever since.
Yeah.
And before I pressed record, I was asking you, when did you know or think about being a mental health nurse?
Yes, but can I start by just a quick reflection on the first time I met you? Student nurse, your elective placement one in the research department. You were just fantastic. I think I knew you were just going to fly in this profession, so well done. And it's just great that we are working together now.
Yeah.
Yes, so when did I know I was going to be a mental health nurse?
Jane said 5 years old, so...
Wow. Never in my life did I ever think I was going to end up a mental health nurse. So just a bit of background. I come from Ghana.
Yeah.
And then growing up, I wanted to become a pharmacist actually.
Really?
And
was that from a young age?
Well, I think from probably about 13, 14 years old. And when I finished obviously high school and everything, at the time, this is just to put in context, Ghana, it was only one university that offered pharmacy, right?
Wow.
So you had to be extremely brilliant.
Okay.
Or, you have to find other ways of doing it, right? So I actually ended up doing a course in dispensing technology. Okay. So I worked as a dispensing technician for a little while, and the idea was to come and top up to become a pharmacist in the UK.
Okay.
And then I came, things didn't work out as planned. Now, I have a friend who is in leadership position in mental health. He works in Liverpool. And then he was the one who was speaking to me about mental health nursing. At the time, I could tell you where I'm from culturally, when you mentioned the word nursing, it was mostly a profession for women at the time.
Okay.
And I'm talking about around 2001.
Right.
Things have changed, isn't it?
Yeah.
So it took a little while for me to get my head around it, and eventually did applications and went to Dundee University to do my nursing. Jason, I can tell you, it's probably the second, if not the first, most important decision I've ever made in my life coming into nursing.
Why specifically mental health nursing? Was it a practical thing? Was it something where you went, I think I'd be good at that? What guided that sort of, how did you arrive there?
I think I was mostly influenced by my friend who was already a mental health nurse at the time. And I think there was some flexibility in the work that he was doing at the time. He was working in the community mental health team at the time. I knew he worked from 9 to 5.
Okay.
He had the weekends where he could do some overtime as well. So as a young man, obviously looking at it from obviously the financial gains, I thought this would be the one really.
Yeah, that's an unusual response when someone says thinking about nursing, the financial gains, but that's nice to hear.
Yeah.
That's okay. So thinking about you're doing your training at Dundee. How did that shape where you thought you might go in your working career? Was there something that you thought, I really like that, that's what I want to do, or not?
Yeah, so obviously at this time I hadn't really sort of invested time in the care sort of profession at the time. So it was at the time when I started, and obviously you're going through interpersonal care theories, nursing theories, and all of a sudden I think something just clicked, and a profession which gives you an opportunity to relate to people, to develop these relationships and support people. At the time, probably they are in the lowest of their lows, you see. And then I came across one nurse at the time. She was a mental health nurse. I was working in a care home at the time just to make a few bucks at the time. And then there was a debate as in who is the better nurse really, a general nurse or a mental health nurse.
Brilliant.
There's something that she said, I've never forgotten it. She said, it takes a good nurse to mend a broken leg, but it takes a better nurse to heal a broken heart. it stayed with me. And I think for me, the fact that I'm able to support people, to help them, a lot of times really people feeling depressed, it doesn't really matter what kind of mental health it is. There is always that element where people seek, that sort of reassurance and then that support, whether it is network, but somebody to care for them.
Yeah, that's a really nice way of putting it, actually. And I think it's quite human to be able to relate to that. When I think of some of the challenges I've had throughout my life, I think, like you say, something, not necessarily, but a lot of the time, the physical thing, I can kind of see it and I can tangibly, you can Google it and that's what I do. Mm-hmm. Whereas with mental health, there's this different sort of aspect of sort of controlling human emotion and how I react to certain situations, which is far more sort of complex.
Yeah. Absolutely. And one of the things that I tell my students in mental health, your best tool is you as the individual, isn't it? Your communication skills and your ability to relate with people. It makes such a huge difference. And of course, that has translated in my personal life as well, you see. So I just find out that even among my peers, I just attract people. They will just come and share issues with you because one, they know probably you are professional about it. You probably have had worse, cases before. But I think that ability to empathize with people. Yeah.
Do you think, I was probably going to ask this question a bit later, but it's come up now. So do you think that was, if we think of Gabe before you did your nurse training, was that something that existed there? Or is it something that developed as you did your training, that ability to sort of empathise with people and react and sort of help them in that way?
I want to believe there was some elements of it there. But I think through the nursing training, I was able to apply theory to this. And I think it's being able to just work out at what point do I have to do this intentionally, isn't it? So you do things conscientiously rather than organically. Of course, if you can do it organically, that is brilliant. But it gets to times in nursing or even in our relationships with people where you have to just make a decision that, no matter how the situation is for this individual, I'm going to empathize, I'm going to be there for them, I'm going to support them. And I think that is something that I've gained from my nursing training and throughout my career.
And I suppose that also that it is a skill. A lot of the time when I speak so I teach skills as part of my role, and we can see skills as kind of a piece of equipment. But in mental health nursing, our equipment is sort of all these frameworks we've stored in our head, and we're sort of intuitively using those to structure our interventions. So that's really interesting. So let's just think about your career. How did your career develop sort of, and why did you develop in a certain direction? What was it about that, your career trajectory?
It's a really good question. So, I think usually when people qualify, you want to work, you want to go maybe a band 6, band 7, managerial. That's usually the natural progression. Interestingly enough, when I was in third year of my university training, there was a lecturer, John Boyrob, who I've lost contact with. And he had a PhD qualification at the time. And then when he was marking my dissertation at the time, he had a very interesting conversation with me. He said, I think you've got it in you to go further. So whatever decisions that you make, really, think about how you can also impact on the generations that are coming, really. So I think right from the onset, the very day that I stepped into a ward, I had it at the back of my mind that yes, I'm probably going to do my master's, and after the master's, whatever opportunities come my way, I'm going to seize it.
And we've had a similar sort of pathway. I remember bumping into you in Tesco's. I think it was mid-COVID or something. Yes, we both had our masks on, and I didn't quite, we hadn't seen each other in a while. I was like, I recognise his eyes. That must be it's Gabriel. And we were sort of mirroring each other's stress somewhat in our kind of, where we were in our PhDs and those sorts of things. Do you feel that I felt very much that my employer was very supportive of me when I sort of had various choices, like I wanted to do my MSc, I wanted to do my PhD, and I think something I can advocate for in terms of mental health nursing as a career is how supported you are when you notice the thing that you like in doing it. Was that your experiences?
It was my experience. I think I was lucky enough to have been working in the research department at the time, and I think you are exposed to, you know, highly skilled researchers with high qualifications as well. So yes, you rub it off them sometimes. So at the time I had done my master's, I had an opportunity to do a clerk fellowship. It's now called ARC. I think they sponsored your PhDs in it. Yes, so I did that 1 year fellowship, and it exposed me to, you know, research methodologies and what have you, but also, you know, teaching you the skills of facilitating, you know, teaching and engaging with people. So it was after that really, I was having a conversation with my manager at the time, and it was like, okay, so what next? The research department actually sponsored my PhD. I did it part-time. I wasn't as lucky as you. I did it part-time, so it was quite spread out, you know, almost 6 years. I was given that space, you know, to do that. And because I worked in the organization, recruitment of participants got much easier. I got all the needed support that I wanted from the ethics perspective and governance perspective. Yes, and I was able to,
How did that change? So when you did your master's, you'd done your PhD, has that changed how you might interact with the patient population?
I think so, and I think one thing though I have realized that the more I study, the more I realize I don't know much. And I'm sure it's the same for you too. Because yes, nobody can be a custodian, you know, of this wealth of knowledge that's out there. But I can actually see how I put some theories into practice. So for example, we talk about consultation models really. That there is this, you know, bit about consultation model called the golden minute really. That is when you meet somebody for the first time, how you want to establish that relationship. Just make sure you are empathizing, more or less gaining the trust of that individual. I do that, and then sometimes I can actually get it at the back of my, this is the golden minute, you see. But I think it's just that exposure to the theories, to the books, you see. Of course, you try not to theorize everything. But one thing I have noticed, though, is that doing all these studies, just ability to kind of critically look at things, you see. So I don't take things on face value anymore. Yes, so
I think that's so important, and I think that sort of permeates into it. It's probably quite annoying. If I was on the other side of that, I'd be like, just tell me like what the answer is. But often you're helping people with that critical thought about what are you doing, why are you doing it, is it perfect, or could it do with some sort of adjustment and adapting? You know, is it our best guess at the moment? And I think that's really important, because in nursing, it's constantly changing. So what we do is constantly changing. So if I've taught you one thing, it's not particularly helpful. If I've taught you to be critical, then that's hugely important.
It is that old Chinese saying, if you give a man a fish, you have a single but teach him how to fish. But fish all his life.
There was me thinking I was being clever, but it's like, you know, it's not a thing. Okay, all right. So what I think is really interesting, actually no, I was going to ask you sort of another question, but before I do that, I suppose what has been coming up is that there's this balance in nursing as a whole, but mental health nursing certainly, about it being incredibly rewarding, but with that there are challenges. And I think that's a reality that most people would accept. What did you find challenging in your role, and how did you manage that?
Okay, so before I came to the university, I was the professional lead for reducing restrictive interventions for our class. So as you know, in mental health practice, there may be times when, you know, because of the illness, the severity of it, maybe we may have to force maybe some medications on people. There may be times when people things can get escalated and we may have to restrain people. My job was to ensure that when these interventions were used, they were used obviously proportionately, if it's necessary, and of course it's in the best interest of the patient as well. But also it's actually sort of done sort of within the confines of the law, and of course the policies as well, you see. I think it was when I was doing that job and then constantly reviewing incidents and then just ensuring that I'm going back and forth to the staff, making sure they're all right, making sure patients are okay, but also ensuring that, people are following these rules and policies to the core, you see. It made me reflect on my own practice when I was working on the ward, really, because a lot of times I think the pressure of doing, our work and then making sure we are respecting human rights. People have got autonomy, and of course they are cared for. But sometimes you have to balance that, to ensuring safety. So a typical example would be a patient desperately needing to be hospitalized, and then they are refusing to come into hospital. We may have to section them, isn't it? So just balancing that sort of emotive aspect of our job with the care that we give, and we give sort of unconditionally, and that's how it's supposed to be. But of course things can get a little bit heated. How do you ensure that even in that space where you are giving empathy and care, you will still have to deal with some hard stuff to ensure the safety of the patients, other patients, and then the staff as well.
And that is so important. I always think there's this kind of paradox between the sort of perception of what a mental health nurse is, but the reality of people in really severe emotional distress. And if we all think of how we react in that way, I can think of times in my life where the distress has been so great that I haven't reacted in a way that I would, on reflection, have liked to have reacted. And there's that really difficult sort of balance between us keeping people safe, helping them therapeutically, respecting their autonomy, and that to me is a real skill.
And the job is so rewarding. I can reflect on some incidents where maybe some patients thought there's no light at the end of the tunnel, life is no longer worth living, and probably contemplating on ending it all. And then we've engaged with them, and then probably 4 years, 3 years down the line, you probably see them in the city center. I've had the situation where a patient came back into hospital for respite, and then this patient was reflecting on an incident that occurred about 3 years ago. I was involved in that incident, and I was just shocked at how this patient was telling me back all the words that I was saying to him at that particular time. And then he was saying to me, Gabe, these things you were saying, I never thought it would happen to me. But look at me now. I'm married. I've got, a flat. Things are pretty good.
That's
nice. See? No, you reflect on these moments and you know that definitely you have impacted on somebody's life. That's really lovely, because that is, I guess we're not always sort of able to see that, are we? We may, especially in certain areas of our work, we might sort of care for people and then they're discharged back to their homes. We don't necessarily see that, so that's wonderful. Do you think nursing has changed you as a person? Oh, certainly. It really has changed me. I think I go back to the fact that, yes, empathy. And then ensuring that, people are doing things, out of their own will, autonomy, that's it, isn't it? But the fact that, the concept of everything I do should be to the benefit of that individual and not, for my benefit. It is something that governs the care that we give as nurses, and actually it guides even my personal life, really. So yes, of course sometimes it's not conscious, but you realize that you go out of your way to make sort of changes. And of course, we have our NMC code of practice as well, which tells us that even out of work, you have to behave in a professional way. So you can't help it even when you are driving and an incident has occurred. I find myself stopping to go and check whether I can help, isn't it? When you see somebody probably in the city, maybe feeling a little bit confused, you can help. You are attracted to that just to support that individual.
That happened to me once, and I thought, well, this is my moment. And I stepped out of my car, and there was a paramedic there in plain clothes. There was a moment where I was like, well, I think in this situation, you're more appropriately suited to this. It was a cyclist had fallen off their bike. Okay, and I suppose if we could wind the clock back, and we've got young Gabriel about to go to Dundee and do his mental health nurse training, what one bit of advice in hindsight would you give young Gabriel?
I think I'll be telling him that, yes, I think you are in it for a long haul. It's a profession that is going to, expand your horizon. There will be opportunities coming your way. Just grab it as you go. And then just realizing that actually you are among a group of, excuse me to use the word, elites, and elites in the sense that, yes, it's a skill that you acquire through the training. Not everybody has got that. You see, that ability to listen to somebody really and then support them at the time of when they are feeling that low, and then at time they've lost trust in everyone. No, it's a privilege, really. It's a privilege, and I will say to Gabe that this privilege, don't abuse it. Yeah.
Wonderful. Well, thank you. You've had an impact on my career. We've had similar career paths in some respects as well, especially our sort of clinical academic pathway that we've taken. So wonderful. Thank you for your time.
Thank you.
Hope you found that helpful.
Cheers.